Angie, you ready?
Yes. Dr. Julie Basan,
Present.
Maxine Reneves,
Present.
Marisela Jacquemin, Laura Medina,
Present.
Gabriel Martinez,
Present.
Jaime Montes, Marina Medina.
Here. So we do have a quorum. Thank you so much. Welcome to the Suicide Prevention Committee meeting. Today is Wednesday, April the 24th. It is 5:36 p.m. on my watch, and I will now call this meeting to order. We have already done the roll call, and I'd like to go ahead and take a moment to do a small reflection. If you will allow me the time, I would really appreciate it. Heavenly Father and everlasting God, thank you, Lord, for another day of life. Thank you for another day with your blessings. Thank you for always showing us the right path to take. Forgive us if we don't pay attention. But join us today as we gather as your family to continue to plan and advocate for everyone in your community. I invite you, Lord, to join us. In your Son's Jesus Christ's name I pray. Amen. Then we have public comments.
No public comments.
Thank you so much. The next item is the committee membership. And the first item under that subject is the status of swearing in of committee members that are still pending to be sworn in. Looking at the list of members, I see that Ms. Marisela Jacquemin has not been sworn in. Is that correct?
Correct.
And I'm just curious and wondering if we can follow up with her.
Yes, Stephanie from City Secretaries was gonna be approved, all the ones that have not been sworn.
Okay, very
Yes.
good. Thank you. The other item on the agenda is the committee secretary. And I think that there's times when we've met, especially last meeting, we had very healthy discussion about many things. And this is what it takes for us to come up with a solid project, to have discussions, to participate, to present our ideas for what we have seen or heard in other areas that maybe we can incorporate in our community. And I know that we're all focused on presenting our ideas and making sure that we convey the message as clear as possible. And sometimes we don't have a lot of time to make notes, and I speak for myself, and I acknowledge Angie for her support and the public health department as well. But we do need a committee secretary. And there's one individual that is very willing and committed and stepping up to the plate to help us stay organized, because I believe that if we're going to continue to move forward, we've got to do it at a very good speed, but so that we know where we're going and not continue to repeat ourselves at each meeting. So with that being said, Mr. Old Medina has agreed to be committee secretary. So I think I would like to invite the members to make a motion if you agree and accept that he be the committee, the secretary for the committee. Motion. Okay, so Marina motion and seconded by Maxine. All those in favor?
Aye.
Opposed, same sign? Very good, the motion carries. Welcome, Earl, thank you so much for. And of course, we will all support you, but we will look to you to help us stay organized in these meetings. Thank you so much. Any questions under committee membership? Very good. Now we move on to the City of Laredo Police Report on statistics. Welcome, Lieutenant. The floor is yours.
Thank you, Mr. Khan. We're having some difficulty.
Yeah,
So, what I'll do is, for not having that compatible with the system here, but Chief Federal Gonzalez sends his regards, probably not being able to be here. I know that some of the issues that were discussed in previous meetings were, none of this falls under the project, the ongoing project would be for the posters. I think that was discussed in the last meeting. So we'll get to that in a bit. So we actually had a very concerning month so far, this month. We've actually had 4 deaths by suicide. Beginning on the 14th, we had a hanging, which was a 29-year-old female. We had a 24-year-old male the following day, and that was also a hanging. And then we had a 64-year-old male with a gunshot wound. And then we had, which is a bit of an anomaly, is a 19-year-old female by a gunshot wound. Yesterday we had an attempted by hanging, but it seems to have been picking up. This past month we had 6 with 4 deaths. Beginning in the service calls related to these types of calls, that so far for 2024 we had 41. We had 227 reports taken, and suicides resulting in death we had 10 so far. Emergency detentions we have had 218. In January, regarding the suicides, the deceased, we had 4. February we had 1, March 1, and this month, unfortunately, like I just mentioned, we're up to 4 again. One out of the 4, the female who's 19, she's the only one that we could ever confirm if she had any history with Border Region. She was part of the jail diversion program. She did reach out for services. She had some pending charge involving narcotics, involving her spouse and family. But what was a little bit concerning was that the last contact made with Border Region was in December of 2023. It was actually a misappointment. So I know that with that said, there's a lot on our plates for everyone, any which way we look at it, but the case management is what we're trying to focus on. And I say that as a whole in the sense of case management for Border Region, including us. We're going to be focusing more on co-responses. I believe the co-responses it provides that security for the caseworker. But at the same time, it does limit our resources with the mental health unit. We're only 3 right now. We're looking to get some more personnel. We're finally off of the pilot program to have a mental health unit with the police department. So we're in the process right now of making the selections to either at least make an addition of 1 or 2 more officers. And we do anticipate that we're likely going to lose 2 of them to promotions, which will probably be, we'll have a better idea as to who they are in May. But again, this all goes back to resources. If they're not working late like they are right now, they're always out there pushing whatever message we can help with, health fairs, any sort of courses, any sort of education, and we welcome those if anybody wants to come in to our department and provide those to the masses being patrolled, because usually that's what you're going to get with anybody facing a crisis. And a lot of times, you all know as well as anybody, it's just a matter of talking. They just want to be heard. And I think that communication, having that communication is key. I'd like to say that the program has been successful. The mental health unit has been successful so far, especially given our resources. It's gotten to the point where they ask for the officers by name. They're that familiar with them. And again, with the core response, the additions, what we have in mind is to do a better job of case management in any way that we can. As we've said before, anyone that worked with us, we believe we should be the last entity that anyone calls. But when we want to help people in the right direction. And it's to no fault of anybody, it's just a matter of they don't know where to turn. So that's what we're trying to get that message out. But again, these 4 cases from last week,
comment in our meeting, but it's the reality that we have to understand, and this is why we're gathered today. I know you mentioned there was 6 attempts. Would you give me the age groups? Because I have 29 female, 24 male, 64 male, 90 female, and the other two.
The other two was a 17-year-old male by cutting, and yesterday's was a 24-year-old female by hanging.
Thank you so much. And so, like we mentioned and we discussed in previous meetings, this impacts all of us, and none of us are immune to it because the age groups vary, right? But it seems like the young adults are the ones also still in the group that has this happen to them. So I think that's leading us, or reaffirming to us as the committee and community members that we need to continue to look at that group to create more awareness, because the schools are doing great, but what about the young adults? And so I have some comments on that, but I want to invite the committee members to see if they have anything to bring to the table about the report that the lieutenant just gave us. Gabriel, what do you think? Anything to add or questions for the lieutenant?
Yes, thank you for that. I think, thank you for the presentation and for the report, and certainly a tragedy of the members, especially in such a short period of time, right? And definitely, as we progress, we can find different ways of improving and finding ways to get the word out there for different resources, but certainly those cases are far too many in such a short time.
Thank you so much. Maxine?
Once again, thank you for the reports. I mean, it's the statistics that we all need to be aware of. It's kind of hard to hear this information, and we send our prayers to the families that are going through all this hardship. My concern is exactly what can we do to help out our community to spread the word that they're not alone, that they have somebody to talk to. So we're open for ideas to understand how can we, I guess, reach out more, whether it's by posting it on the social medias, newspaper, bulletin boards, anything that we can to help them know that we are here to support them.
If I could just interject, somebody's talking to the families, the detective that did this follow-ups. For example, the female that was by hanging, no prior outcry, no prior attempts. So that leaves the family with that many more unanswered questions as with all of this. The 64-year-old male subject was going through a separation. And just to add to that a little bit more, the spouse was recover, thankfully, they're basically very reluctant to speak on that. Understandably so. I mentioned that.
Thank you, Lieutenant. Marina, anything to add or?
Yeah, on April 10th, I did get a call from one of those attempts. They told me that there was a young female, she wanted to take her life. They were asking what could they do to help, and I told her to call the cops. She did. They took her to Border Region, and I think she was there for a couple of days. She did get released, but she was asking like a lot of questions, like where do they go, what do they do, and that's something that I wanted to ask you. Like, I did get to call somebody at Border Region and ask them like, where do they take them, or what do they do? They did tell me that if they have insurance, I think they keep them there at Border Region, but if they don't, they take them out of here to another clinic or hospital. I just like, the mom wanted information, but since she was already over the age of 18, they couldn't provide it to her unless she had given permission for her to get information. So I just like, maybe if you can like explain a little bit the process, like what happens, you get the call, you go to the scene, what happens after that, they take them, or when do they don't, or just a little bit so I can explain, you know, like getting this call, well, I was like freaking out, like I was like, what do I do, you know, it was hard.
So the authority that any police officer has is basically, to simplify it, to hold somebody on emergency detention, would be 3 prongs. One of 3 prongs that we need to meet, which is the person has to be a danger to themselves, a danger to others, or to be in a deteriorative state where they are likely to be a danger to their own welfare. If none of those 3 prongs are met, then we have no authority to hold them, but we do our best to make contact with resources that can help them at the time. When they are taken to Border Region, one of the first things that usually happens 9 out of 10 times is that they're gonna ask for a medical clearance at the hospital. The hospital prioritizes them based on their own system. I have learned that a mental health crisis is actually considered a category 2 emergency. Doctor, I don't know if you want to correct me on that if I'm wrong, but category 2 would be the equivalent of somebody experiencing a heart attack. Category 1 would be more so somebody like a shooting victim, so on and so forth. So that's how they go, that's their process. The hospital, it can take a while. They might endure the whole crisis there and then want to leave. Likely the assessments are unique, so that's where those complications come in, want to leave. Once they're cleared, caseworkers from Border Region are already working on it. To answer your question about the insurance, yes, it is a factor. It's not up to us though, but that's basically just as far as where they're gonna situate them if they are to go to an inpatient facility. Inpatient facilities typically would go through San Antonio State Hospital. That in itself is a very long wait. At one point, about a year ago, we're talking maybe about 120 days more or less. Minimum. Of course, they can't wait that long, so that's why they outsource to private hospitals in the valley. You have McAllen, you have, there's one in San Antonio that they do use, but that comes down to the same thing, which are unfortunate factors that they have to keep in mind. It also comes down to the observation at the time by the mental health specialists, you know, and a lot of times those are done through Zoom nowadays. So what to expect, it could go either way. It could be more than likely they will end up in an inpatient facility. We don't hope for that, but the usual response, if it's not that, is to release the individual with a safety plan, and that's where it's very important to have a family, that structure, that support system. But like you mentioned, a lot of this information is privileged, and that's where family wants to know, what can I do? And very limited. So it's just a matter of a lot of overlapping factors.
Sorry. Thank you, Lieutenant. Thank you so much for that. And you know, just to add to that, each case is different. You know, there's a standard protocol to follow, but each person is handled differently depending on their needs, the immediate emergency. But thank you for sharing that. I hope that we all have a better idea of how those calls are handled. Anyone else? Dr. Chamberlain, would you like to add something to that?
I appreciate the sharing of the stats with the group. We were made aware of the increase of incidences that were occurring throughout the city last week. And we will provide a little bit more in the next agenda item during the current projects about what we do have planned. But it's a very unfortunate situation that we're observing right now, especially regarding the majority, 50% of them are under the age of 30. And we are seeing an increase of females this year that are, I mean, we're all equal, males and females with mental health issues, but there's been a lot more action within the female demographic, and it'd be interesting to learn more through the investigation of what they might have been experiencing in their background, whether it's a partner that was threatening them with releasing a photo or whatever it might be. So that way we know how to target more interventions to help them seek the support they need in those times where they're feeling like they have no one. So we do look forward to hearing more from the investigative part, so thank you so much to the team for doing the work that they do, and for being out there during these difficult moments for the families as well that are experiencing these situations.
Thank you, Dr. Chamberlain. And I echo those comments about thanking the entire team for being out there as first responders. It's always you, the ones that are out there doing your job and doing it the best way that you can. But also, you also need to take care of yourself. Mental health is important, and we're all here to support you. The next item on the agenda is the report on current projects, and I just want to say that the last time we met, as I mentioned, there was a healthy discussion about different things, what we could all do with the minimum amount of money we had, which was $0. And we all agreed as committee members to go online, and thank you for sharing the website, to request those free resources that are available to us. And I know my team, I asked them for each one of them to request them and have them mailed to their home address. We should be getting that, and I requested some for the office as well. So, did you have a chance to request some of those resources?
Yes, as far as my part, when it comes to the resources, and I don't know if we're gonna jump on it right now, but when it comes to the Bethany House project, I mentioned that to you, and so we have the green light with them to be able to put our resources out there with them. So we have the green light to put those posters and note cards and provide some even to a caseworker that they have, and so they can have access, but they were thrilled about that.
Thank you so much. Thank you for that. Maxine?
For the poetry contest, for the students, we had to wait till after STAR. So for 6th grade, today was the last day of that, but 7th and 8th grade might still be testing the rest of the week. I'm not sure.
Okay. And you know, it doesn't have to be for this year, it can be for the next year. And just for those of you that were not present, Maxine brought up a very good idea that we should do like an art contest amongst the students. And since she is an educator, we thought it would be great if she could start at her school and see how it goes, and maybe it'll trickle to other areas. So thank you for that, Maxine. Were you able to order some resources from that?
No.
Okay. So we will get you that link. Yeah. Thank you. Let's see.
Yeah, I was able to order some resources, and I'm trying right now to get an organization to donate some banners as well. Somebody's gonna create an artistic form of that, so we're waiting to see what we could get. And once I get more information, I'll go ahead and share it with the committee.
Excellent, and I have something to share on that as well. Thank you, Earl. And thank you for everything you do. Marina?
I took some of the stuff to Nixon, and I did, the counselors they already put them in their offices. Also for the college, they're gonna ask for permission. I'm pretty sure they're gonna say yes, so, I got with Erica, we're gonna get some resources and take it to them.
Thank you so much. And I know some of the other ideas that we talked about was putting some kind of sign or banner inside the bathroom stalls, posters, or whatever people would let us place in different areas at the mall. And all of that is great, but we have to be realistic, like how much can we do that is gonna be effective, right? So let's keep that in mind. I wanna invite Dr. Chamberlain to give us information on the report of current projects.
First and foremost, I don't know if Dr. Hassan has already mentioned that she is organizing an event on May 1st. Would you like to share a little bit more on Dr. Hassan?
Yes, I think I mentioned it briefly, but it is confirmed Wednesday, May the 1st at 10 o'clock at the Jovita Idar Park. I'm inviting all of you and the coalition membership to come out to the park, and it's a gathering. The main idea about this gathering is to come together, and for those of you that want to create a 30-second, 15-second message, I want to get as many of you as possible individually, and then what we're going to do is we're going to create those and throw them out in social media, the TV, whoever wants to put it on their channels, YouTube, whatever. I want to do that. I want to go to the school boards and ask them to allow us to do that. But we have to have the raw material. So that's going to be one of the things. The other thing is, since we did mark the 1-year anniversary of the coalition when we kicked off the initiative, we will be recognizing some agencies and that have gone above and beyond in helping us get that word out in the last 12 months. So go ahead, Dr. Jimmy.
Thank you, Dr. Hassan. After we were made aware of the increase in prevalence of suicide attempts and unaliving events that have occurred, we got together, our team here at Public Health, and our Public Health team has made requests for additional 98 resources. Thank you, Erica, to our Public Health promotion team, and we'll get others so we can get more in since it's only a limited amount per person. But we are in the process of designing banners as well that we will employ at all of our events. And we will be sharing those designs and the quotes with the school districts and of course the colleges and the universities, since those are the demographics right now that we really want to concentrate on, so that they're at their entrances. And these would be about 8 feet high. That's how tall they are. 8 feet high, not that wide, but they're the retractable ones. And just to be able to increase that awareness of 988 when they're stepping in and out of school. And also just letting them know that it's okay to talk about their mental health, which is extremely important. We have scheduled, and we'll have those done by May 3rd. We're scheduling a mental health awareness proclamation at City Hall to bring more awareness, and that'll be May 8th to mental health overall, and making sure that we're tackling our cultural issues that impede many from sharing what's really on their mind. We are developing and will be filming a PSA to advise the community what is 988, and this is all from the team and us collaborating. So thank you to Christina and Adriana, Hyman, and Ms. Erica. Because we say call 988, we call 988 often, but we're going to break it down in this video with members of our community, with representation of persons that look like us. So that way people truly understand what is 988, and that'll be taped as well. We had such a successful event with our knock-in talk for substance use disorder and naloxone distribution that we will be employing a knock-in talk to get into the neighborhoods to let people know and advise them of what is 988 and to break down those statements that are associated with mental health. So we are planning for that to occur, and other organizations are more than able to join us. This will happen from May 20th to May 31st. They'll be earlier in the mornings because we're not able to reach those persons' information. We got at least at their doorstep. When I was at the university earlier this year providing a discussion for the kinesiology students, all of them did not know what 988 was. And so that was very disturbing for me to know after all the work that we're doing, that group still doesn't know. So that group doesn't know, neighborhoods don't know. So that's why we're taking that action to the streets. Followed by, we do have the City of Laredo Summer Guide that the Public Health Information Office is putting together, inspiring people to go around the city to get in the know of different types of services that we do have. Public Health wasn't part of it, and now Public Health will be part of it. Individuals will go on the scavenger hunt, scanning these codes, adding their name in to be able to get into a raffle. Ultimately, what we're doing is just increasing the literacy level of the resources that are available specific to mental health. And lastly, we wanted to be able to tackle large crowds of persons. We connected with the Tecolotes team, and at 3 of their large events, which is Monterrey, and I don't know the other ones, they will be hosting Public Health, and anybody else, of course, that would want to join that event will have the 988 banners, we'll have our tents out there. We are ordering several baseball stress balls that will have 988 out there so we can engage with the audience, throw them out into the audience, have their gorilla throw them out to the audience, and ultimately even have the players dressed with 988 somewhere on their jerseys. So we're very, and also putting it on the Jumbotron, talking about it in between. So we're very, very, very happy about this non-traditional public health partner. The baseball team coming in to help, especially for those persons that are potentially in that age demographic that are there at the event, or for anybody who might be in a troubled time or reaching a point of crisis in their life. So we'll have one in May 17th. The second would be in June 28th and July 13th. So we're very happy to share about the partnership with the Tecolotes. We appreciate them. We appreciate the connection with the mayor after we had this idea. It happened from one moment to the next, and it came to fruition already. So we're
Could you repeat the dates, please?
Game 1, May 17th, Game 2, June 28th, Game 3, July 13th.
Thank you so much.
Absolutely. And this is just what we planned out in an hour on an afternoon last week, so there's still more to come. We know that we have to continue to be very active, very loud, and continue to elevate the community. So count on our support to the best of our resource ability. And we're very fortunate to have found a little bit of resources to help maximize what we're trying to accomplish, which is preventing more situations of suicide attacks in our community. And of course, unfortunately, our life events.
Thank you so much. Comments, questions on Dr. Chamberlain's presentation?
We're excited to get out there and try to target more of the community outings and places that we know people are at. And like I said, it's not about them coming to us, it's about us going to them.
Thank you so much. I think those are wonderful ideas, and I speak for myself and I don't know the other committee members, anything that they can do to support you by being present.
Please.
I love all the ideas. I love the fact that we're motivated to make sure that everybody in the community knows about 988. And it gives me a lot of pride to know that we care that much, right? To not stop at one idea or one project, but to continue being innovative and also hopefully succeed in lowering the numbers that we're currently seeing. So, but it takes all of us to believe in the message. So thank you, Dr. Chamberlain, for your leadership. Again, come and be with us on Wednesday, May the 1st at 10 a.m. That's going to be a very engaging and very motivating event. I hope it will be. But I need each one of you to be Pleasant. And we will be making a special presentation to both school districts on some resources that a generous sponsor gave us to present to them. And it just makes me feel good to know that people step up to the plate and call me and say, I will give you this to make sure that you have this message where it's needed in the neighborhoods. So come out that day and learn more about that. I know we also had something about the Coasters project. Did you get anything on that, Lieutenant?
Yes, and actually today, Chief Gonzalez informed me that earlier in the day, he met with David Vasquez from Gateway, he's the president of the Bar Association downtown. So in their discussion, he basically said he's all for it. There's even some funding there that LNF Distributors has for some socially responsible projects. The logistics of it are still being, are pending to be discussed. I know that we're gonna get Attorney Joaquin involved in as far as the donation side and what we can release and so forth. The discussion about the QR code was going to be linked to that, if there is one, and what we're going to put out, or what we decide to put out, we'd like to be the ones to dictate that message and make sure that, because I know that everybody's going to want to put in their 2 cents, whether it's LNF or anybody else, any particular business downtown, but I think that's important that it stays within this, when we get to that point, so just to ideas of limitations or whatever we decide we want on there, to create that website, wherever it's gonna, that QR code would potentially take. But again, the funding is gonna be looked into, through LNF, and I don't know if that's something that we might need to discuss further.
That's great news, and this is the perfect timing because we can begin to think about exactly that, what message do we want to focus on, or how do we want it to look. And I think that we all have ideas, and that will be our homework for the next meeting, to come up with suggestions, and it doesn't have to be complicated, just make a list or make your own message or your own design. I know we talked about the Coasters having the QR code that the City of Laredo Health Department developed, because that will be changing as we add resources, but the QR code will always be the same. So we can definitely incorporate that, because in that QR code, we will have the 90-day as well. So, but in addition to that, what else would we like to have? So that's great news. Thank you so much, and convey our appreciation to the chief for us. Anybody has any questions or comments on that report? Okay, the next item on the agenda is discussion and possible action. The update on the You Are Not Alone awareness activities, I already reported on that, and I do hope to see most of you there next Wednesday. And just like you met with your team, Dr. Chamberlain, we had the coalition meeting last month, and it was very healthy discussion. And I will email you all the ideas that everybody came up with. I know some of your staff were part of that meeting as well, but we kept notes of that, and I should have brought a copy with me, but I'll email all of you so that you can have a copy of the different ideas that came up, the different members brought to the table. And I just wrote them all down, and I told them every idea is great, and we will work on the list based on our resources, based on the timeline that we have. So if anybody wants to develop the idea that's presented, it belongs to the community, so it's not the coalition or the committee or, you know, AHIC or the health department. It's ours to take it and run with it, because all messages that save a life belong to all of us. And as community members, it's our responsibility to do what we can in every way possible. So I will email that to all of you and Dr. Chamberlain so that you can have it. The next item on the agenda is other. Does anybody have the table about any topics related to what we learned today, or suggestions, or maybe something that's been on your mind about our committee? Do you feel that we're making progress? I think it's the question that I'm going to pose to each of the committee members. Do you feel that we're making progress where we are today compared to where we were when we first met? What do you think?
Certainly, I think the efforts that Dr. Chamberlain mentioned and all the efforts that we've been doing, we definitely don't go unnoticed. I think I saw a billboard with the 988 recently. I don't know if that was something you had. Yes, so it's fantastic, but I think we're making great strides, but it's not enough, right? And so I think we keep pushing ourselves on that and keep on brainstorming, but I think we're definitely improving a lot. I know I ran out of cards of giving them to all my clients, right? And different places where I go, so definitely.
Thank you for that. Maxine, what do you think?
I think we are, like, it takes a lot of people to come up with different ideas, like, no one can do it on their own, and I'm happy to see so many people here today, like, feels like we are making progress, you know, and each one of the ideas is valuable, and everyone else has a different perspective, so that helps also, but we are going in the right direction, you know, we can't reach everyone all at once, but we're headed in the right direction, I think.
Thank you for that, Maxine. Earl?
It's like how everybody's saying, like, we are going in the right direction. Everybody's point of view is really a train of thought, and we just need to put it in play little by little. So gathering all this information from everybody is a great success, and like Maxine said, I'm like, it's a great turnout today.
Thank you so much, Earl. Marina?
I want to feedback on everybody. I mean, if there is a lot more people since when we started, and I know we have still 2 vacant spots, so I'm thinking about who else I can bring on so we can be all full. And also, I have a question. Is the 988 number, is it only calling? Can we text to it, or?
You can call or text.
Or chat, that's all.
Okay. But yeah, I think we're done.
Thank you very much. Lieutenant, anything to add?
I think that the consistency has served everyone a great deal of that, laying down the foundation, the organization, the structure alone goes a long way. I think it's fair to say that a lot of us have seen committees come and go, or when they're here, they fizzle out, you know, people start coming. But as far as the way, I really appreciate the way that it's operated, the way that everything is taken into consideration. And I don't see it going in any other way other than improving.
Thank you so much. Dr. Chamberlain?
Just say thank you to everybody for being present, for taking time out of your day to be able to ideate here with the group and ultimately push this from development into implementation, as we've been seeing what we've been doing, and we will continue to do, because we are here to elevate and to multiply.
Thank you so much. At this point in time, I'd like to see if anybody in the audience that's not a committee member would like to comment or make an observation.
If I can speak on behalf of Laredo Public Health, we're still out there doing our outreach events. We've put up 988 information at the Metro, at another Will Wash, at Organic Coffee, the Gym Legacy. We did distribute business cards with the 988 number at Wing Daddies, Goodyear, at the City of Laredo Human Resource Department. We did go to PD with Lieutenant Margarita Covera, and we did provide 988 cards, as well as health department cards, and it has the QR code on the back so that they can go ahead and distribute. She mentioned they're pretty much getting suicide calls daily. So I went ahead and dropped those off to her. We also dropped off at the City of Laredo Community Development Department, and tomorrow we're dropping off magnets, stickers, posters, and cards to off by City of Laredo libraries. So we're trying to get the message out there. Our program is setting up a billboard for 8 weeks starting June 1st to promote our services, but we will also include the 988 logo and information there. So that will be pretty much the several months.
Thank you, and thank you for that outreach. It's amazing, and I congratulate all of the team for doing that. You know, when we do something, we don't know who it's going to touch or who's going to read that message. For all you know, it's gonna be one of our loved ones or friends or colleagues that, because that banner's there, they will take a moment to reflect on what they're thinking about. Anybody else?
I did also want to mention that something that wasn't on this list that I was reading, which is us working, we're going to be collaborating also with the Laredo Chamber of Commerce. I know we mentioned, of course, we might not be able to reach many people with putting decals at all locations, but at minimum in restrooms at restaurants where we have high traffic. Is where we're specifically targeting, as we do know that one of these most recent situations was a restaurant employee and as a person who worked in the industry for 10 years in another life. I know that those individuals do talk amongst themselves and you know what's happening at one restaurant or the other, since they do cohort together. So we're going to make sure that that information is out at the restaurants, and we will also be purchasing these decals that are not stickers, but that are vinyl that'll adhere, and they can remove them and it won't damage their property as well. So we'll be getting into those restrooms. So if you're having a moment while you're out, you look at yourself in the mirror and go find it there.
That's excellent. Wonderful.
That's one. I'll fire up y'all.
I love that idea. Again, thank you for all those fantastic ideas. And how do you measure our success? You can't measure it. The only thing we can do is measure how much we are doing, right? And so let us all re-energize and rely on one another to continue to move forward with ideas, with implementing those ideas and making sure that within our possibilities, we're able to get the message out to everyone. Anybody else?
Just a long-term idea of something to consider. Call taking. People call 911 for, you know, it's either police or fire. It's already been implemented in other cities where we have that third prong, and that's going to be crisis line. So actually having somebody on board that's certified to talk to anybody that's in crisis. Currently, we do have some of our dispatchers that actually make the reference to the 988, so they actually transfer the calls to crisis line. When they see that it's something that requires an immediate response, well, then it'll get transferred back, as it should. But to actually have somebody there, and again, this is a long-term idea, long-term project that a lot of cities are getting to. It's just, we can kind of start brainstorming now for whatever anybody can offer, or we can put out there, maybe it's down the line. It can actually be something that we can actually put in our budget and get somebody implemented within our call taking.
Like the crisis hotline?
Or somebody, some cities actually have caseworkers working within the communications department.
How is a crisis hotline volunteer, 24-hour call in Houston? So I think it works amazing, and it requires people in the community to really support it. So count on my support for that. Anything I can do. Thank you.
We can also start looking at grants to see if there's any that we can collaborate with agencies and for that.
Very good. Anybody else? Okay, our next meeting will be May the, let me make sure, it's the last Wednesday in May.
29th.
May the 29th? At 5:30, but in the meantime, mark your calendars for next week, please. At the same time, next Friday at 8:30, we will have a mental health and substance abuse symposium. Dr. Chamberlain is one of our keynote speakers. It is at no cost unless you want credits for your license. Please sign up and join us. It'll be a wonderful event. It'll be at the IBC Annex on Jackman. And come out there and support the information that is going to be distributed via our speakers, so that you can go back to your place of employment, to your family, and share what you learned. Empower one another with knowledge, and at the same time, offer that support just by providing a smile, opening somebody's door as they're walking into a building. Sometimes that's all people need to feel, that somebody cares. Right? So I invite all of you to do that. And with that being said, would somebody like to make a motion that we adjourn the meeting?
Motion to adjourn.
Maxine, second? Gabriel, second. All those in favor say aye. Opposed, same sign. Okay, the meeting is adjourned. Thank you, ladies and gentlemen and friends, for all of your time.